Hello, we are excited to be organizing the 9th annual MIDAS conference to increase diversity in mathematical modeling and public health. This conference is a great opportunity for undergraduate students to learn more about modeling of infectious diseases, and we are especially interested to involve students from underrepresented groups in modeling research and training. Modeling can help reveal important features of the biology of infectious diseases. It can also help governments develop control strategies against epidemics. And of course, we all know how the COVID pandemic has really highlighted the importance of modeling to fight epidemics. You don't need any modeling skills or other skills to join this conference. It's really meant for everybody to join. There'll be world-renowned researchers and also graduate students to lead this 3-day conference. There'll be lots of hands-on interactive ways to get familiar with modeling research. And it's helped really in previous years to get undergrads started in training and research in infectious disease modeling. They've made great contacts and new friends. So I would say if you're interested in modeling or learning something about modeling, what it's all about, join and don't hesitate, apply now.
Fellow math and science enthusiasts with a passion for public health, have you always wondered how modeling actually works but never had a chance to explore it? Well, maybe this is the first time you've been introduced to this field, or you've already dipped your toes in the area and are eager to learn more. Either way, this is a conference for you. We invite undergrads from underrepresented backgrounds to access some of the popularized and fundamental tools used to address many of the key questions asked during this pandemic. So first, what do we mean by modeling? A model is just a mathematical description of some process. And in infectious disease modeling, we investigate how infections like SARS-CoV-2 can spread through a population. We then think critically about specific ways in which disease processes may occur in a given setting, which we write up in the form of equations after making some simplifying assumptions, and can input into a computer program to simulate an epidemic. We can then ask, what happens in the future as the epidemic spreads? And what happens if we intervene in a certain way, such as by vaccinating half the population? Infectious disease modeling tools are everywhere. They've helped inform pandemic policies on how to strategize and improve different prevention and control programs, and to what extent and where to administer them. Crucially, through mathematics and statistics, they offer guidance on best practices using a variety of data sources. Oftentimes, there's limited data at our disposal, which forces us to be creative in designing and integrating a medley of methods to address the problem at hand. We believe that producing and sharing this research should be as accessible and inclusive as possible, especially when we have vulnerable communities whose needs are often ignored. For this reason, we think it is so critical that we gain more diverse perspectives and experiences in the modeling community. Encouraging more people from underrepresented groups to engage with this field is absolutely necessary for building a more comprehensive and all-reaching response to pandemics. With lectures and research talks, hands-on applied sessions, and project proposal groups, we have everything to suit your learning taste and style. We just want to emphasize that this workshop is designed to accommodate different levels of prior coursework or training in math, stats, and coding. We hope you can join us.
Last year is the first year I attended the Diversity Conference. It was a wonderful experience as an organizer, and I hope as an attendee. The students' feedback from last year was overwhelmingly positive. And beyond learning concepts of mathematical modeling, this conference is an opportunity to connect with like-minded peers and maintain those connections in the future, because you are the future of infectious disease modeling. And we really hope that we get to meet you at this conference.